Hello, I'm Dr. Samuel A. Agayu. I'm a nephrologist. We're going to be discussing high blood pressure, urinary tract infection, and kidney disease. High blood pressure. High blood pressure puts you at risk of heart disease, strokes, and kidney disease. Usually does not cause any symptoms, but it can be very serious. When they say you have high blood pressure, there's two numbers to look at. There's a top number and a bottom number. The top number is called the systolic blood pressure, and that number tells you what your blood pressure is when your heart is contracting. The lower number is called the diastolic blood pressure, and that one tells you what the blood pressure is when your heart is relaxed. When they tell you your blood pressure is elevated, that's a warning sign that your blood pressure is not as low as it should be. People with elevated blood pressure do not yet have high blood pressure that needs to be treated, just need to be evaluated. How can I reduce my blood pressure? Blood pressure medication. The most important thing is to take your blood pressure medication. If you have side effects on the blood pressure medication, don't stop taking it. Speak to your doctor or nurse about the problem that you're having. They may be able to switch the medication or lower the dose. If cost is an issue, mention that too. They may be able to get you the medication at a reduced cost or find another medication that is cheaper. Taking your blood pressure medication is very important. It can help prevent heart attacks, kidney disease, and strokes. Things you could do to lower your own blood pressure. Number one, if you're overweight, lose weight. Number two, diet. Diet low in fat and rich in fruits, vegetables, and low-fat dairy can be helpful. Reduce the amount of salt you eat. Do something active for at least 30 minutes a day on most days a week. Cut down on alcohol if you drink more than 2 alcoholic drinks a day. 3, get a home blood pressure meter. People who check their own blood pressure at home tend to have low blood pressure. Kidney stones. Small stones that form inside the kidneys. They form when salts and minerals that are normally in the urine build up and harden. Kidney stones usually get carried out in the body when you urinate, but sometimes they can get stuck on the way out. If that happens, the stones can cause pain in your side or in the lower part of your belly, blood in the urine, which can make your urine pink or red, nausea, vomiting, pain when you urinate, and a need to urinate in a hurry. How do I know if I have kidney stones? If your doctor or nurse thinks you have a stone, they might order imaging tests that can show the stones. How can stones be treated? Each person's treatment is a little different. The right treatment will depend on the size of the stone, the type of stone, location of your stone, how much pain you have, and how much nausea and vomiting. If your stone is big or cause severe symptoms, you might need to stay in the hospital. If your stone is small and only cause mild symptoms, you might be able to stay home and wait for it to pass on the urine. If you stay home, you'll probably need to drink plenty of fluids, plus you might need to take medication to help you pass the stone easier. Kidney stones that do not pass can be treated with shockwave lithotripsy, a machine that uses sound waves to break up the stone into smaller pieces. Does not involve surgery but can be very painful. Percutaneous nephrolithotomy, special kind of surgery that makes a very small hole in your skin. A doctor passes tiny tools through the hole into the kidney and removes the stone. Uroscopy, a thin tube that goes into your body through the same way urine comes out. Doctor uses a tool at the end of the tube to break up the stones and remove them. How to prevent kidney stones? Number 1, drink plenty of water. Number 2, change the type of food you eat. Certain foods actually may exacerbate the amount of stones you have within your body. Number 3, your doctor may prescribe certain medications for you, which will help reduce the amount of stones you form. Urinary tract infections. Urinary tract is a group of organs in the body that handle the urine. You have 2 kidneys, 2 bean-shaped organs that filter the blood to make urine. You have 2 ureters that carries the urine from the kidney to the bladder. The bladder is a balloon-shaped organ that stores the urine, and then you have the ureter, a tube that carries the urine from the bladder outside the body. Urinary tract infections, also known as UTIs, infections that affect either the bladder or the kidneys. Bladder infections are more common than kidney infections. Bacteria gets into the ureter and travel up into the bladder. Medical terms for bladder infection is cystitis. Kidney infections happens when the bacteria travels even higher into the kidneys. Medical term for kidney infections is pyelonephritis. Both Bladder and kidney infections are more common in women than men. Symptoms of a bladder infection: pain or burning feeling when you urinate, need to urinate often, need to urinate suddenly or in a hurry, blood in the urine. Symptoms of a kidney infection: symptoms of a kidney infection can include the symptoms of a bladder infection, but kidney infection can also cause fever, back pain, nausea, and vomiting. How do I find out if I have a urinary tract infection? Call your doctor or nurse and explain your symptoms. If your doctor or nurse are concerned that you may have a urinary tract infection, they may do something called a urine test. If they're concerned that you have a kidney infection, they also may do a urine test that checks for bacteria. How are urinary tract infections treated? Most urinary tract infections are treated with antibiotics pills. These pills work by killing the germs that cause the infection. Bladder infections: need to take antibiotics for 30 to 7 days. Kidney infections: need to take antibiotics for a little longer, up to 2 weeks, and you may need hospitalizations. Symptoms should begin to resolve within 1 day of standard antibiotics. Make sure you complete the antibiotics treatment course, otherwise the infection may come back. If you're having a lot of increased urinary frequency with the UTI, you also may want to take some medication that can numb the bladder. People who get lots of bladder infection: number one, you should check with your doctor or nurse to make sure you're really having bladder infections. Symptoms of a bladder infection can be caused by other things. Things you could do to reduce the amount of infection: number one, drink plenty of fluids. Number two, definitely follow with your doctor, and they'll give you more ideas and tips on how to reduce the number of infections you're getting. Can cranberry juice or other cranberry products prevent bladder infection? Studies suggesting that cranberry products prevent bladder infections are not very good. Other studies suggest that cranberry products do not prevent bladder infections, but if you want to try cranberry products for this purpose, there's probably not much harm in doing so. So if you're having symptoms of high blood pressure, urinary tract infection, or kidney stones, you should definitely follow up with your doctor for evaluation. I'm Dr. Samuel A. Agayu. I'm a nephrologist. Thank you for watching.